Hi and welcome. It's Jessica Drummond here from the Integrative Women's Health Institute. And today I'm excited to talk to you about why I believe that all rehabilitation professionals, all physical therapists or physiotherapists, if you're outside of the United States, and occupational therapists need to begin to understand and utilize appropriately nutrition as a part of all of our practices. So, welcome. And here are the reasons why it's important for all physical and occupational therapists to understand and begin to utilize nutrition as a key piece of the puzzle in our practices. The bottom line is that chronic disease management is our job. That is the bread and butter of our jobs at this point. You know, there is less more acute infectious disease. There is less acute injury compared with the vast amount of chronic illness that we're dealing with. Chronic joint pain, obesity, diabetes, chronic fatigue, cardiovascular disease, cancer, all of these chronic disease management roles that we play as physical and occupational therapists is the key and growing segment of population that most of us are working with. 45% of all Americans suffer from at least one chronic disease, and I would venture to guess it's actually more than that, and it's growing. If you look at the amount and percentage of chronic disease in children, chronic disease accounts for 60% of deaths worldwide. So this is not just a problem in the United States, it's a problem throughout the world, and particularly in the Western world. Professional organizations are American Physical Therapy Association, Occupational Therapy Association, other major physical and occupational therapy organizations worldwide are recognizing the important role of nutrition as a key piece of rehab professionals' work with patients recovering from illness or injury, even those acute illness and injury, and combating chronic disease. Plus, there is a strong evidence base for nutrition as being essential medicine for our patients with fatigue, pain, post-surgical recovery, autoimmune disease, cardiovascular disease, neurodegenerative diseases, even traumatic brain injury, and post-surgical or traumatic orthopedic injuries. So we need to be paying attention to the literature and be staying on the cutting edge of and leading edge of our field. What is the why here when it comes to rehab professionals becoming more skilled at using nutrition as a part of our practice? The bottom line is that if we don't understand and utilize nutrition, often collaboratively with other professionals, but often, giving skilled recommendations ourselves, our manual therapies, our movement therapies, our pain science education, our functional movement education, all of our therapies will not be as effective if we don't have an understanding of nutrition that we're utilizing as a key part of our practices. Because the bottom line is that our patients' biochemical resilience matters. You can do manual therapy that's very appropriate. You can do exercise prescription that's very appropriate related to joint pain, for example. But if their underlying biochemical environment is chronically inflamed, or they have a hormonal imbalance, or their digestive and immune functions are not working very well, then the message of pain or the message of tissue dysfunction is going to continue to be relayed because of that internal biochemical environment. So if you're like me, you might have gone into a rehab profession because you didn't have to take as much biochemistry as going to medical school. And that is truly one of the reasons I chose rehab medicine. And the bottom line is I was wrong. We have to understand the biochemical environment, and nutrition plays a huge role in that. And there's more and more research coming online about the role of nutrition and other lifestyle medicine like stress management, relationships, and the impact on our gut microbiome, and the impact on our hormonal environment, the impact on our inflammatory cytokine environment in the brain, for example, and throughout the body. So we have to understand this baseline biochemistry so that our biomechanical therapies can be much, much more effective and faster. So let's have some fun today. At the end of this webinar, I have a special invitation for you. So stay tuned until the end. And if you're like me, you always have 100 windows open on your computer. I would please ask that for the next little bit, we eliminate distractions, close all the other windows, silence your cell phone notifications, and find a quiet place so that you can focus on what we're going to discuss today. To tell you a bit about me, if you don't know me well yet, I started my career as a physical therapist. I began in orthopedics. I was an athlete and I liked science, so it was kind of a natural progression to go into sports medicine and orthopedic physical therapy. And pretty quickly, though, within the first few years of my practice, I began to specialize in women's health, which is still a lot of orthopedics of the pelvis and the lumbar spine and the hips and, pre and postnatal orthopedics, but also pelvic floor issues and pelvic pain, pre and post female cancers, lymphedema, urinary incontinence, male pelvic pain and incontinence issues. So that was the core of my physical therapy career, which I'm still involved in to some extent. I had my first baby, who now looks sort of like Katniss up there with her bow and arrow, my little redhead. She's now 13, so she was born in 2003. Right after that, or around that time, I began to personally experience a number of vague symptoms, kind of burnout, anxiety, sometimes really severe panic attacks, chronic pain, pelvic pain, infertility, crushing fatigue, and constantly getting every cold and flu. And for a long time, my doctors simply said, "Oh, well, you just had a baby. You're supposed to be tired. Oh, let's put you on an antidepressant. Try to take a nap." There was no real solution for this constellation of vague symptoms that I was dealing with. But ultimately, I found a functional medicine practitioner, and she diagnosed me at the time, and this was a long time ago, nearly 10 years ago now, with adrenal fatigue. And we now have a much more nuanced understanding of what adrenal fatigue is. So don't get distracted by that. It's more about a hormonal, a stress response, HPA axis dysregulation. But the bottom line was my personal experience with how poorly Western medicine and allopathic medicine really deals with chronic, vague symptoms that are across a multitude of systems. So, I was having mental health issues. I was having reproductive health issues. I was having pain. I was having fatigue. And, I was kind of passed around. There was no good way to deal with the root cause of all of these things until I found functional medicine. So I went back to school because this is what I do. I'm a kind of a type A, and became a nutritionist. Just finished my doctorate in clinical nutrition from a functional medicine perspective in a couple of months ago in 2017. And, almost 10 years ago now, not quite, more like 7 years ago, my little daughter was born. So I was able to overcome my own personal health challenges between my new education and utilizing that in my own body. And in 2011, I founded the Integrative Women's Health Institute. And we've been training women's health physical therapists and occupational therapists and across disciplines. We teach midwives and fitness professionals and health coaches, psychotherapists, gynecologists, nurse practitioners, naturopaths, acupuncturists, you name it. We work with those professionals teaching functional nutrition for women's health in a way that is very integrative and evidence-based because of my strong training as a physical therapist was very evidence-based. Emory University graduate here, and that was drilled into me. We have to practice in an evidence-based fashion as best as possible. So that's what I've been doing for the last 6-7 years. And now recently have decided to bring this to physical and occupational therapists who work outside of women's health in orthopedics and neurology and cardiac medicine and geriatrics. So it's time to expand the importance of functional nutrition as a part of rehab practice, as a part of normal everyday rehab practice. So this is a mindset shift for those of us who are trained in allopathic rehab medicine. We rehab clinicians need to begin to shift our focus from quieting the symptoms. That was always my initial goal. Let's see if we can, lower the pain level from 8 out of 10 to 2 out of 10, right? Instead of focusing on quieting the symptoms, let's focus on optimizing the system, optimizing each of your patient's biochemical and biomechanical physiologic systems. And then you get to root cause healing, which allows the symptoms to melt away on their own. All of the symptoms, all these symptoms like I had that seem to be unrelated. So a functional nutrition versus an allopathic nutrition approach is a shift away from just a focus on symptom management to a focus on systems optimization. So optimizing the digestive system, the immune system, the neuroendocrine system, the musculoskeletal system. And we really have that focus already to some degree as physical and occupational therapists. Now we're just expanding to looking at all of the systems in each of our patients. Additionally, allopathic nutrition tends to teach a more public health nutrition recommendation focus. And unfortunately, that's often in collaboration with the food industry. Instead, in a functional nutrition approach, there's a personalization to how we take nutrition to our patients. So instead of saying things like, are tomatoes healthy? Is yogurt healthy? We're asking, for this patient in particular, given her genetics, given her current injury or illness, is she pregnant? Given her athletic endeavors, how active is she versus how sedentary is she? Given her digestive function, given her immune system function, is X food going to be nourishing for her or depleting and potentially causing some of her symptoms? Because for some patients, tomatoes are extremely healthy. They're packed with vitamins and minerals. They're very nourishing. But if you have someone who has chronic joint pain and they're sensitive to nightshade vegetables, removing tomatoes can make a huge difference. I had a patient who had a spine fracture. She had osteoporosis young. She was in her early 30s, got in a car accident, had a minor spine fracture, but had chronic back pain for years. We took out nightshades. Her pain completely resolved. She had been to physical therapy and Pilates and core strengthening till the cows came home for years. And just removing nightshade vegetables completely resolved her pain. Now, she had a pretty complex case, so there were other issues, but we have to pay attention to the fact that the question is not, is X healthy? It's, for this particular client in front of me, what are all the factors that I need to think about before making a nutrition recommendation or referring someone for an appropriate nutrition recommendation? And who will they see? How do we vet those people? Also, in allopathic nutrition management, there's a focus on only supporting with nutrient supplementation severe deficiencies like rickets, for example, versus in a functional nutrition approach, we're looking to optimize biochemical pathways. So, and genetic enzymatic expression. So, for example, let's say someone has a genetic SNP that makes their methylation pathways, so I'm going to get a little biochem on you here, sluggish. Well, for those people, supplementing with certain B vitamins can be very supportive. You have to be mindful of all of their SNPs, their genetic single nucleotide polymorphisms, to make sure you're not over supplementing with those B vitamins in a way that they can't break them down or metabolize them. But as you learn these biochemical pathways, you can start thinking about, well, we know that optimal vitamin D levels are very important in pain management. Do you know your patient's vitamin D levels? Optimal magnesium levels are important in chronic pain management. Optimal methylation function is important in chronic fatigue. So we have to start thinking about and asking these questions and supporting our clients to find the answers to them, whether we can give them or we find them through collaboration with other professionals. Additionally, in allopathic nutrition, we're looking at things like really directing food plans, measuring carbs, counting calories, right? But the truth is, especially when it comes to things like obesity and diabetes, if you have patients who are overweight or have blood sugar instabilities, which is becoming about half of our patients if we have an average population in the United States, sometimes much more, then we're going to help our patients to intuitively understand, when am I feeling full? Am I eating food that is information, not just calories? Because certainly 200 calories of broccoli is very different than 200 calories of ice cream when it comes to the information that food is telling our genetics, right? Telling our genes and how to express. So if you have a patient who's obese, restricting their calories to X number, but the calories is mostly ice cream versus mostly broccoli, it's going to be a very different outcome, right? So we need to focus on patient empowerment. They need to start learning when they're feeling hungry versus when they're feeling tired or bored or sad. We have to look at, we have to teach them to understand their own physical responses to nutrition by doing these sort of not constant, we don't want them over-focused, but day in and day out kind of N of one experiments. So if they start to notice a little bloating, do they know what to do next to shift their body back into alignment? Or if they start to notice a little bit of joint pain, what are some things that they might be able to do to relieve that pain? And there's a whole spectrum of things. It may be changing their nutrition. It may be getting better sleep. It may be assessing the stress in their life and how they're balancing it. And as we learn a functional nutrition approach, we can give them these tools, which is so empowering for us and for them, because they don't have to feel like they're walking around with this chronic illness that they have no control over, that they're just a victim of. So going back to kind of the history of the allopathic nutrition approach, from 1977 to the 1990s, under pressure from meat producers, federal dietary advice was evolved from decreasing consumption of meat, which is generally a good public health recommendation, to have 2 to 3 daily servings. Again, that might be too much. It depends on the client. It might be exactly right. But if we're having the federal government make these general public health claims when in fact they're being directed by the industry that is going to profit from those health claims and not looking at the individual and what he or she needs, 2 to 3 servings of meat might be perfect for the client who has great digestive function but is protein deficient or has blood sugar instabilities. But what about someone who's lacking stomach acid? 2 to 3 servings of meat per day could be causing huge problems, or if they have a sensitivity to certain kinds of meat. So these incidents that shifted how the landscape of nutrition was taught from the 70s to the 90s and continuing on are all of these conflicts of interest between industry and the nutrition recommendations. And as we were just talking about, this does not personalize the recommendations or take genetics, physical exertion, current illness or injury, surgery, or other stressors into account, because that particular blanket recommendation is profit-driven. It's not patient-driven. So back to the reasons why we, in particular, as physical and occupational therapists, physiotherapists, need to understand nutrition. The bottom line is that chronic disease is our job, but I'm not a nutritionist. Well, technically now I am a nutritionist, but you are not a nutritionist necessarily. I am going to argue that that does not matter. Every clinician, whether you're a midwife, a physician, physical or occupational therapist, psychotherapist, if you are a licensed clinician, you need to understand nutrition. If your client is eating fast food, candy, caffeine, and alcohol, all of which are barely food, they are not going to get well despite almost any of your other therapies, right? If you're a health coach, if you're a fitness professional, if you're a wellness professional of any kind, you need to have a basic understanding of nutrition because everyone eats. And if they're not, they're certainly going to get sick too. That's a whole different problem, right? And nutrition is key to health. At the end of the day, your patients can't medicate, exercise, or supplement their way out of a bad diet. Your manual therapies, your exercise prescription cannot help a client recover if their underlying, foundation of nutrition is not strong. And you have to recognize that while certain aspects of nutrition may be outside your professional or personal scope of understanding or practice, you have to understand this so you can refer people to appropriate practitioners because everyone eats, and they're thus on their team, everyone struggling with a chronic illness needs to have at least a great one nutrition professional, or ideally all of the professionals she is working with, from her physician to her physical therapist to her occupational therapist to her psychotherapist to her nutritionist, needs to have some understanding of nutrition so that they know how it impacts their therapies. So who are our patients, right? They're people who've had a surgery, a traumatic injury, diabetes, obesity, heart disease, stroke, neurodegeneration or neurodegenerative disease, traumatic neurodegeneration like a traumatic brain injury or spinal cord injury, autoimmune disease, chronic joint pain, fatigue. Just stop for one moment and recognize how these patients are eating when they are in their rehab and recovery is going to be essential to how well, if they're able to fully recover, how quickly they can recover, and importantly, their sense of empowerment around their ability to make decisions. Every time they pick up their fork, they're making an empowered decision about something that can enhance their health and help speed and deepen their recovery. So we have to think about our patients. We have to understand this so that they can heal better and in a more empowered way. What our patients eat matters. Nutrition matters to improve digestive and immune function. If you can't take in nutrients, how are your cells supposed to recover from a traumatic injury? How is your brain supposed to become, optimize its plasticity with a neurodegenerative disease or injury if, it's not getting omega-3 fats, right? The brain is built of fat. What if your client is eating hardly any omega-3 fats and all sugar? We're going to be promoting brain inflammation and minimizing the raw materials that brain has to heal. So you can be doing your neuro recovery exercises, but they're not going to be as effective. And certainly with autoimmune disease and chronic joint pain, it's essential to reducing inflammation, to improving the immune function. Interestingly, the immune system cannot function well with too much inflammation. If there's too much generalized systemic inflammation, the immune system cannot target itself, cannot align itself with kind of fighting off pathogens because it gets sort of confused. It just doesn't function as well. And so we start to gather more and more autoimmune looking patients that have underlying Hashimoto's disease. That's, I think, about 60% of American women at this point. rheumatoid arthritis, even things that haven't been diagnosed as such. When we start thinking about joint pain as having an underlying autoimmune component and we look at it from that perspective, again, we get to the root cause and symptoms begin to melt away. Mitochondrial functions the same way. If there's too much inflammation, someone's extremely stressed, they're eating lots of sugar, they're living on caffeine, their mitochondria are going to be stressed. And of course, they're going to feel chronic fatigue. Most patients have very poor nutrition. So again, even if you're not a nutritionist and you're not, getting very detailed into genetics and labs and all of the, supplement dosages, which some of you will be excited about and be able to get into and be able to do that very appropriately. But for those of you who just want to begin, there's so much work for you to do. Every single one of your patients needs support because at least 1 in 4 people now eat some type of fast food every day. Americans are consuming 31% more packaged food than fresh food. 20% of all American meals are eaten in the car. Not to mention hospital food, right? What about you guys who work in acute care? Someone just had a traumatic brain injury or a cardiac surgery, and they're giving them like mystery meat airplane food, right? They need nutrients. They need vitamins and minerals and fatty acids and amino acids as the raw materials of healing. You can't heal when you don't have these nutrients. And if your digestive system is messed up, even if you're eating a nutrient-dense diet, you can't absorb it. So we have to be advocates for our patients. We have to support them to shift to real food. Food is information, right? It's not just calories. So what does that mean? What your patient eats directly impacts his or her genetic expression and the functioning of her physiologic systems. So does stress. So do toxic exposures, environmental toxins. So does the health of the gut microbiome, all the beautiful organisms that live in our colon and our skin. And there's microbiota all over our body, in our mouths, a placenta. There's a vulvovaginal microbiome, a penile microbiome. So we have to understand how this group of organisms, these communities of organisms, can be very supportive for our patients and can also be detrimental if they're out of balance. So functional nutrition goes way beyond food and nutrients. And so there are so many factors of this that right away you can bring to your practice and improve your patient's healing results. You have to understand the core concepts in nutrition. How do we optimize digestive function? So that's where we begin in our training. Is the digestive system working? Is it working optimally? What simple things can we do to support that? Because again, your clients can be eating a really clean diet, but if they're not absorbing it, then they're not going to be able to utilize those raw materials. Immune function is huge. Even if you don't feel like you work with a population of autoimmune disease, if you work with anyone with joint pain or fatigue, autoimmunity and immune function issues should be just top of mind. Big red flag. Start looking at that with every client. We have to be looking at the impact of nutrition on the nervous system, on the cardiovascular system, on the musculoskeletal and hormonal systems. We also have to learn to critically read nutrition research. We talked about a minute ago, the Department of Agriculture changed a lot of its recommendations based on recommendations from the meat industry. And they've also done so based on recommendations from dairy industry and corn industry and such like that. So what are the funding sources? What are the conflicts of interest? Do these studies have adequate power? What are the mechanisms of the impact of certain foods on your patient's biochemistry? What are these underlying mechanisms? Our understanding continuously evolves. So as a rehab professional, we need to learn to read this literature. And even if some aspects of this are outside of your scope of practice, you need to support your patients with very simple things like quality education around where to get good functional testing, how to learn to cook, and other resources, how to find supplements that are safe and of high quality, how to determine the benefits and risks of various dietary recommendations to your individual client who might have a health condition, or she might be pregnant, or she might have other risk factors. And thus, we have to develop a quality network of referral partners. So whether you're working in a hospital organization where there are internal people to refer to, you still need to vet them and make sure, they're the kinds of practitioners you would want to send your own family to. And certainly, if you're in a private practice, you have the luxury of really determining and creating your own network of referral partners and cross-referring relationships. Nourishment is so much more than food. So we also have to learn to critically review the data on sleep hygiene, work stress, mindfulness, support networks, relationship stress, genetics and exercise. There's some interesting, cool new data showing that people with different genetics, shouldn't be lifting weights as much. Some should be lifting weights more. Really cool stuff. Trauma history, medication-related nutrient deficiencies and system impacts, and so much more. Understanding how to educate and coach patients to nourish themselves is really with healthy and good lifestyle medicine, whether that's sleep or, heavy weightlifting. These can be very nourishing. Nourishment is not just about food. That is often the key to getting them both root cause healing and empowerment so that they're leading their own healing journey, which is what I see in the physical therapists and occupational therapists. We've taught hundreds now around the world. Those professionals who really learn to help their patients feel and be empowered in leading their healing journey are so much less burned out. And this is especially important given the chronic health concerns that we deal with on a daily basis. And at the end of the day, our professional organizations are encouraging a wellness approach and supportive nutrition. So let me read you the new American Physical Therapy Association position statement. Diet and nutrition are key components of primary, secondary, and tertiary prevention of many conditions managed by physical therapists. It is the role of the physical therapist to screen for and provide information on diet and nutritional issues to patients, clients, and the community within the scope of physical therapist practice. This includes appropriate referrals to nutrition and dietary medical professionals when the required advice and education lie outside the education level of the physical therapist. This is part of your practice. From the American Occupational Therapy Association, occupational therapy practitioners can assist clients to develop simple, concrete, measurable, and achievable self-management goals consistent with the 7 behaviors advocated by the American Association of Diabetes Educators. And this is speaking in particular around patients with diabetes, of which there are hundreds of millions in the United States alone. These self-care behaviors are, number 1, healthy eating. And you can read the rest. This is a part of your practice. Because each state has its own jurisdictional scope of practice, physical therapists and occupational therapists should check with their state practice act, which may be silent on nutrition. If that is the case, physical therapists need to turn to state laws governing nutritional practice, which, like physical therapy practice, these practice acts are adopted individually by each state. In addition, each physical therapist should consider his or her personal scope of practice before engaging in nutrition and dietary services. This is key. This is a part of your practice, but because you probably didn't learn a lot about this in graduate school in your physical therapy or occupational therapy program, it's your responsibility to learn it now. And the more in-depth and clear your personal scope of practice is, the more you can offer your clients. So it's time for you to take ownership of your training around nutrition, because if you're interested in this, the more you learn in many states and in many locations around the world, the more you can share with your clients, and you can be such a great resource for your clients and your patients and your community. Did you get enough nutrition training in your rehab program? Probably not. So that's why I'm offering this. We're starting to teach physical and occupational therapists outside of women's health, as I said, in orthopedics and neurology and cardiovascular health and geriatrics. What is your personal scope of practice? How much do you know about nutrition from an evidence-based standpoint? Do you have a structure for how to educate your patients on nutrition? We take a very systematic approach so that we are making sure, is their digestive function optimal? We have to start there. Otherwise, any nutrient supplements we're giving them are not going to do anything, right? Do you have a skilled or trusted, a network of skilled and trusted nutrition colleagues who take a functional approach? Do you understand enough about what a functional approach is to find those people? Do you understand how poor or excellent nutrition impacts your patient therapy, your patient's physical therapy or occupational therapy results and prognosis? Can you really be a chronic disease or injury recovery expert without nutrition knowledge? I don't think so. So we take an evidence-based approach to functional nutrition as medicine for rehabilitation patients in particular. When we do that, you will find a match between your expectations and your patient or client expectations. And this really, as I said earlier, empowers your patients to make these choices every time they put something in their mouth, every time they lay down to go to sleep at 9:30 instead of 2 a.m, every time they go outside and do their exercise in the sunlight. This empowers their patients to lead and own their own healing, which significantly reduces burnout for the physical and occupational therapy professionals that we've trained around the world. They just feel like they're having so much more fun in their jobs because they're not dragging their patients to healing. Their patients are excited about healing. We take a systems optimization approach, digestive system, immune system, neuroendocrine system, and so forth. And we have systems and strategies for starting very simple to get big results. Again, you don't have to know everything about supplement dosing to talk to your clients about nutrition. Most of them are living on the coffee and wine diet or the fast food and candy diet, or even if they're cooking at home, they're, it's like pizza and spaghetti most of the time, and they're not really getting many vegetables. They're getting a lot of processed grains, very few really healthy fats. There's so many small things that we can do around nutrition, stress, community support, sleep, general exercise, environmental toxin load, reducing all of these physical and emotional stressors through simple but very impactful recommendations that without these things, you're just not getting your patients the best results that they can get. And often your patients already know where to begin. So think about it. If right now you're not feeling awesome and energetic and you have no pain in your body, if you feel that way, great, you're doing a lot of things right. But if you're struggling with any, either even just mild nagging health conditions of your own, if someone put a plate full of Oreos in front of you versus a nice roast chicken breast and a salad, you would know which of those foods is likely to be healthier to your body. So you already know a little bit about where to begin, and your patients and clients are the same way. They already know, I know I shouldn't be staying up till 2 a.m. I know I shouldn't be drinking 6 cups of coffee a day, but they haven't set a foundation, what my friend and colleague Jenny Burrell calls the big rocks. They haven't made these changes. They haven't gone to bed at 9:30 instead of 2 a.m. They haven't started eating vegetables instead of donuts for breakfast, So your confident support that setting the foundation that these big rocks of sleep, of just clean nutrition, of sunlight most days, not for hours and hours, but at least for 15 minutes to an hour, depending on your patient and where they live, right? When you emphasize the importance of the foundational big rocks, your clients are more likely to listen. Because a lot of times, even if they have cancer, their doctors are saying to them things like, oh, it really doesn't matter what you eat. It's not going to impact your recovery. That's insane. Of course, it's going to impact their recovery, what a cancer patient eats. That's crazy. So we have to be an advocate for and supporting of the things that they already know intuitively. If you just got in a massive car accident, I had a patient one time who literally got hit by a truck. He had dislocated his hip. He was stuck in bed for 3 days because he was extremely obese. Every morning for breakfast, his wife brought him a box of Krispy Kremes. Those are donuts, if you don't know what that is. Okay, is that going to help that person heal quickly? Of course not. Of course it matters what he eats. What if he had a vegetarian omelet and a green juice every morning? Is that going to make a difference compared to having a box of donuts every morning for breakfast when you just got hit by a truck and have a hip dislocation? Of course that makes a difference. It's crazy to think it doesn't. So we have to understand this so that we can be confident supporters of our clients. And we have to understand the research about why it matters. Because if we don't really understand it, how are we going to stand up to the cancer doctor and say, that's crazy. Of course it matters what your chemo patient is eating and doing, right? So, stepping down off my soapbox for a minute, let's think about now, what is the functional nutrition approach for rehab patients? Well, let's define this briefly. Functional medicine provides a new model of healthcare delivery and practice that addresses the drivers of chronic disease, such as cardiovascular disease, diabetes, cancer, autoimmune disease, and allergic conditions, digestive, mood, and cognitive disorders by translating existing research into clinical practice through the lens of systems biology. So again, optimize the digestive function. Is the digestive system working? Then what are we feeding it? Is the immune system working? What are we feeding it? How are we resting it? How are we taking care of the immune system? What appropriate exercises are being done? So forth. And each system, neuroendocrine system, biomechanical, musculoskeletal system by system, we optimize. And then all these things that seem to be unrelated, my depression and my joint pain, both resolve. So what is functional nutrition? It's exactly the same as functional medicine, except practitioners of functional medicine are licensed to either do surgery or prescribe pharmaceutical drugs. So generally speaking, they're MDs, nurse practitioners, physician assistants, DOs, things like that. So functional nutrition practitioners don't prescribe medication or surgery, but otherwise it's discipline neutral. So whether you're a nutritionist, a physical therapist, an occupational therapist, a psychotherapist, a speech pathologist, anything that is a licensed professional, you can have a functional nutrition practice. It's a belief system, it's a perspective more than a term, more than a descriptor of what your practice is. It's your perspective. It's your belief that most chronic disease is preventable and most reversible with an individualized integrative approach addressing genetics, diet, nutrition, environmental exposure, stress, exercise, and psychospiritual needs. Much of chronic disease is preceded, again, you believe this as a functional nutrition practitioner, that much of chronic disease is preceded by a period of declining function in one or more of the systems. Now, that's not always the case. Sometimes, especially in rehab populations, we have patients that got in bad traumatic accidents or they had an acute illness and that, triggered the longer term chronic issue. But there often is, someone was kind of overweight. They were on a lot of antibiotics every once in a while. They used to get sick every other year. Now they get sick every few months. It's this slower decline. In our rehab patients, often their systems, again, digestive, immune, detoxification, endocrine, have been declining for a period of time. Plus, there's usually a trigger for the current problem and mediators to sustain the symptom and the underlying cause. So we look at three things in functional nutrition: antecedents. So these are kind of the background history story. Genetics, childhood insults, maybe they had a lot of antibiotics or other medications in childhood, steroids, things like that, or prolonged stressors or adverse childhood experiences. Then triggers: infection, injury, pregnancy and delivery, surgery, accidents, a significant life stressor like a move or a divorce or a big loss, trauma. Mediators are continuing to eat a poor diet, fear, chronic stress, poor sleep, lack of exercise, staying up all night playing video games, not being outside, not having a good community of support. All of these things can sustain the illness or injury to go on longer than it needs to if there was kind of more of an optimal healing environment, a more functional nutrition healing approach. And I want to talk to you about the fact that this is very relevant to our patients in the literature. So if you work with any patients who are overweight, this is appropriate for you. From knowledge of the impact, so this is a quote from this article that was published in 2011, anti-inflammatory nutrition as a pharmacological approach to treat obesity. From knowledge of the impact of these dietary nutrients on these various molecular targets, it becomes possible to develop a general outline of an anti-inflammatory diet that can offer a unique synergism with more traditional pharmacological approaches in treating obesity and its associated comorbidities. And you're seeing all these comorbidities, right? You're seeing fatigue and joint pain and so forth. You already know that eat less and exercise more is a lie. So now we have to learn what is the truth. Again, if you have patients with chronic pain, osteoarthritis, this is appropriate for you. A multiple linear regression analysis indicated that pain was significantly higher with the use of osteoarthritic medications and higher body mass index category, and significantly less pain with the use of supplements and meeting physical activity guidelines. Whereas self-reported health, servings of fruit, supplement use, and meeting physical activity guidelines, again, the pain of osteoarthritis was significantly lower. There is a lot of literature about this. If we're looking at patients, again, with chronic disease, although specific diseases may require specific treatments, such as adjustments for hypomobile joints, beta blockers for hypertension, and chemotherapy for cancer, the treatment program must also include nutritional protocols to reduce the pro-inflammatory state. This article was published in the Journal of Manipulative Physical Therapy in 2002. We have known this for a long time. We have to start using it as a regular part of our practice. And in Alzheimer's disease, for those of you who work with patients with neurodegenerative diseases or traumatic brain injury, this protocol, the MEND protocol, which was designed for Alzheimer's disease, includes a lot of nutrition and these other nourishment factors: sleep, movement, community, stress management. Here we report the results from quantitative MRI and neuropsychological testing in 10 patients with cognitive decline, 9 with ApoE4 positive and 1 ApoE4 negative, who were treated with MEND protocol for 5 to 24 months. The magnitude of the improvement is unprecedented, providing additional objective evidence that this programmatic approach to cognitive decline is highly effective. So again, you cannot treat neuro patients effectively without including nutrition and functional nutrition. Again, visceral pain, chronic pain in animal models and human clinical trials using prebiotics and probiotics. that alter the microbiome. So we have to understand the gut microbiome with resultant alterations in visceral pain responses. It improves visceral pain to optimize the functioning of the gut microbiome system. And that's part of the digestive system. Thus, I hope by now I have convinced you that all physical therapists, physiotherapists, occupational therapists need to develop strong and confident functional nutrition skills. If you want to stay on the cutting edge of rehab medicine, you need to know this stuff. It's been in the literature for, almost 20 years, 15 years. Your patients will get better faster with the powerful combination of skilled movement and manual therapies, plus physiologic systems optimization with nutrition and lifestyle medicine, and your empowering support. So the more confident you are in your understanding and the more empowering you are, and the more that you're able to help your clients build collaborative teams so that they can get great recommendations and support from all multidisciplines that they need. When your clients are empowered and heal faster, you are less burned out. I see this every day with our students, and you just love your work more. You get excited again about it. So I've created a course called Functional Nutrition for Rehabilitation Professionals. It's a global online training program to support physical and occupational therapists, or physiotherapists if you're outside of the US, to add evidence-based nutrition tools to your practice, build your own personal scope of practice, and support you to build collaborative networks when there are things that are outside of either your professional scope of practice wherever you live or your own personal scope of practice until you learn more. Am I qualified to teach you this? You don't know me. How do you know I'm qualified to teach you this, right? Maybe you do. Well, I have been an invited speaker at top conferences for rehab medical professionals for a long time now, I think since 2002. The American Physical Therapy Association Combined Sections meeting, I've presented there twice. International Pelvic Pain Society. I just recently spoke at the Kaiser Rehab Department at the Kaiser Hospital out in LA. I've been an invited speaker for clinics and conferences all over the world, in Ireland, California, New Jersey, Texas, London, New York, Australia, and more. I've been teaching this for more than a decade, probably 15 years now. I've been an invited guest on major podcasts, The Pelvic Messenger, Couch Talk with Annika Becca, and so forth. I do have a bachelor's degree in biology from the University of Virginia. My master's in physical therapy is from Emory University. I have nearly 2 decades of physical therapy experience, 8 years running an integrative practice in functional nutrition and coaching for pelvic pain and other women's health concerns, 6 years of international integrative women's healthcare professional teaching experience, and before that, a lot more teaching experience in physical therapy. I have a doctorate in clinical nutrition from the first program in the world with a focus on functional nutrition, and this is going to grow. Functional medicine and functional nutrition are fairly small pieces of kind of mainstream medicine at this point, but it's growing very fast. It's growing in the double digits every year. The physicians are catching on to this, and it's time for physical therapists and occupational therapists to take ownership of this approach, or we're going to be left in the dust. I was the author of the Functional Nutrition for Pelvic Health chapter in Healing and Urology, that recent textbook, and we've published a couple of case studies on a functional nutrition approach to vulvodynia that was multidisciplinary. This program is for physical therapists and occupational therapists and physiotherapists. We have several levels in this program. I wanted to give you the opportunity to take the program slowly and steadily over time so you could integrate it into your practice and get our support we have an awesome, supportive, private, professional only global community. All of our students are really helpful. We talk about cases, we talk about questions, we talk about our own issues day in and day out in our private professional community. In level 1, We'll be focusing on functional nutrition as for rehab professionals, starting with the importance of understanding digestive function and the gut microbiome for improved rehab outcomes. So I'm going to teach you, how do you assess digestive function? How do you optimize it? How do you look at gut microbiome and help to optimize it with the knowledge that we currently have? In level 2, we'll be talking about nutrition and immune health. If you work with anyone with fatigue or pain, level 2 is necessary for you. Level 3 looks at the stress response and sleep optimization. So remember, functional nutrition is not just food, although food impacts the stress response for sure. Level 4, functional nutrition for rehab professionals around the impact of hormone health on patient recovery. So if your patients, again, if they have pain, especially if they have cyclical pain, but even if they're male, we're going to talk about male hormone pain, male hormone dysregulation and related pain. So if your clients have pain, their hormones may be out of balance. That's essential. And if they've had any neurodegenerative injuries or illnesses, also cardiovascular disease. Don't forget, cortisol and insulin are hormones, right? Level 5, how environmental toxicity can impact your recovery, your patient's recovery. And level 6, nutrition and the brain in pain, fatigue, and dementia. So I think you can see that if you work with anyone with pain or fatigue or a lack of mobility, this program is for you. It's fully online. You can complete it at your own pace, and we have applied for continuing education units. We will post when they have been approved. All of our programs that we have ever applied for have been approved. The payment plans are available for these programs. The pricing details are listed on the full details page. Just click the button or continue to scroll down from watching this video. We have fast action early enrollment discounts. You'll get this full support of our faculty, student, and alumni community for years to come. Once you're in, you're in. And you'll receive membership in our private, professional-only global Facebook group. If you have any questions at all, please email my team at support@integrativewomenshealthinstitute.com. That's support@integrativewomenshealthinstitute.com, and we're happy to answer all of your questions. Thank you so much for joining me today. We covered why all physical and occupational therapists need to understand nutrition and use it skillfully as a part of our practice, how to deepen your skills in nutrition so you can expand your personal scope of practice, allowing you to get faster and more sustained healing results for your patients. Thank you so much. Again, it was my pleasure to share this important information with you. I want you to be on the leading edge of rehab and stick with the global, healthcare movement towards functional medicine. It's not just the doctors now. It's time for all of allied health to get on board. I look forward to getting to know you better and to support you to grow and improve as a rehab professional, helping millions of people to live more vibrant and healthy lives. To get all the details about the new Functional Nutrition for Rehab Professionals program, read on by clicking the button or scrolling down this page. And again, if you have any questions, don't hesitate to email my team at support@integrativewomenshealthinstitute.com.